The faces of ovarian cancer are all around us. There is no early detection test, and a diagnosis can be overwhelming. Too many women are diagnosed late, meaning fewer treatment options and having to use aggressive strategies to save their lives. This is a quiet cancer. It is often misdiagnosed, and women's concerns about symptoms are ignored, overlooked, or dismissed. Not anymore. It is time to ovary-act. Ovarian cancer comes out of the shadows and into the light with the help of the Minnesota Ovarian Cancer Alliance. We fight to overcome ovarian cancer and increase awareness by using thoughtful, effective action in the areas of research, education, and support.
It's just great knowing that MOCA is there, that there are people there that care about this disease and that have committed themselves to continuing research, to raising funds, to supporting women who have the disease.
One of the toughest jobs, I think, is coming out of the operating room and telling a family that their loved one has ovarian cancer. It's something that I don't like to do, and I think it takes a lot of time to get the families through it, and I think that's where education and support groups like Minnesota Ovarian Cancer Alliance are really important and key in helping patients and their families get through this experience.
Part of MOCA's mission is funding research and finding ways to detect, treat, and someday cure ovarian cancer.
I'm very passionate about working on ovarian cancer research, mainly because my mother was diagnosed with ovarian cancer about 25 years ago. In my laboratory, we're really interested in trying to find ways to detect ovarian cancer in its earliest stages.
My ultimate goal for women with ovarian cancer is to find a treatment that will actually prolong their life and to help them. Currently, I received a grant from the Minnesota Ovarian Cancer Alliance that's supporting my research, and without that grant, much of what I'm doing right now probably would not be able to be done.
If we ask a big agency like the NIH or the Department of Defense for this money, they'll say, well, where's your preliminary data? Show us if it's even possible. And so MOCA then will give us funding for these early ideas. Without agencies like MOCA, all of these new ideas would never get off the ground.
My greatest hope for ovarian cancer research is that they would find not only a cure, but there would be some kind of tool, some kind of test that could be done and available to everyone.
I hope that with ovarian cancer research, we can find early detection. That's critical.
Early detection means women live longer. So we reach out to medical students even before they choose a specialty. They learn about symptoms and the survivor perspective from MOCA volunteer educators.
I do the volunteering for medical training because it's such a great way for me to raise awareness.
That will lead to quicker diagnoses if these residents are remembering, oh, I heard this about a woman who had developed ovarian cancer.
Education then extends to medical residents who have chosen a primary care specialty. Primary care physicians are often the first doctors women go to with health concerns.
We give them lectures regarding ovarian cancer in terms of what to look for at diagnosis, the test to order. We talk about tumor markers, CA-125, and how to use that in the diagnosis of ovarian cancer in women who have had symptoms.
MOCA raises awareness of ovarian cancer symptoms among both women and their doctors. Along with research and education, MOCA provides ongoing support for women. There are many MOCA-sponsored groups, community education meetings, and even a mentor program that provides one-on-one support when women need it most.
Out of all the things that MOCA provides to me, I would say I have received a sense of hope.
My family was involved in the activities of MOCA by attending certain education sessions. They really wanted to be more informed about the disease.
I think it's important for people to know that MOCA offers hope and new possibilities, not just for the ovarian cancer survivor, but for the families as well.
I also think that it's a great organization for researchers like myself because we actually see a face in ovarian cancer.
My hope is that someday we won't have to even think about ovarian cancer, but until then we'll continue to go to work every day and work harder for women with this disease.
My one wish for MOCA would be that one of the researchers funded by the Minnesota Ovarian Cancer Alliance would find an early detection test for women, and even better, that they might find a cure for ovarian cancer.
Women are the face of ovarian cancer. In the eyes of every survivor are the dreams and hopes of finding a cure. Minnesota Ovarian Cancer Alliance is the catalyst that will change the impact this disease has on women. No woman should suffer a late-stage diagnosis because of the lack of detection tools. Now it is time to overreact.
Through our eyes, we see possibilities. Through our hopes and dreams, we see all that can be. With our hands, we can help to see it through. From our hearts, we need you to find a way. Day by